Hey everyone, welcome back. So if you ever heard the words QRS axis and had no idea what they mean, today's your lucky day because that's what we're covering. So what is the QRS axis? To put it simply, if you look at an ECG, the QRS axis is the overall direction of electrical flow through the QRS complex. And if you look at this diagram right here, you'll be able to see that a normal axis is actually plus 60. And that means down and to the left if you're talking from the patient's perspective. And that makes sense, right? Because the way the heart sits, from the atria down to the apex of the heart, it's down and to the left. So your overall direction of flow should be down and to the left. So to calculate the axis of a QRS complex, we use 6 leads. We use 1, 2, and 3, and then AVF, AVL, and AVR. And you can see on the diagram here that this diagram is set up in the same way that they're set up on an ECG. And you can also see that there are pairs of leads. So 1 is connected to AVF, 2 to AVL, and 3 to AVR. First, we're going to start off with what normal values are for QRS axis and what abnormal values are. Now, if you look at the diagram right here, you can see the actual coordinate system we use for calculating the QRS axis. You'll see we start at 0, and as you come down and around, you get to 180, right? So that's from 0 to positive 180. Now, if you go on the top from 0 to 180, that's negative. So from 0 to negative 180. Now, if the QRS axis is between 0 and 90, that we call normal. If the QRS complex is between 90 and 180, we call that right axis deviation, because the direction of flow has shifted from going down and to the left to a little bit more to the right. If the direction of the flow, however, is between 0 and negative 90, so in that top quadrant there, we call that left axis deviation, because it means the direction of flow has shifted a little bit too much towards the left. And on the last one, in the quadrant that's opposite from normal, between negative 90 and negative 180, we call that the northwest axis. And basically a northwest axis means something has either gone very wrong or you've put your ECG leads on wrong. So what are some of the causes of an abnormal axis? And we're going to go through all of those, and we'll start with right axis deviation. Now, right axis deviation can be from several things, such as right ventricular hypertrophy, chronic pulmonary disease even without pulmonary hypertension, ventricular septal defects, atrial septal defects, pulmonary emboli, anterolateral myocardial infarctions, and if you've got a posterior hemiblock, that could cause you to have right axis deviation as well. So you can see here that the general rule for right axis deviation is that it's something that either decreases the overall functional ability of the left ventricle or increases the load that the right ventricle has to take in proportion to the left ventricle. But it is important to remember that right axis deviation can actually be normal in children and in tall, thin adults. Next, we're going to talk about left axis deviation. Now, importantly, we said for right axis deviation that right ventricular hypertrophy is one of the causes of right axis deviation. But left ventricular hypertrophy is not a cause of left axis deviation. So the causes of a left axis deviation are emphysema, hyperkalemia, artificial cardiac pacing, so if you've got a pacemaker in, a left anterior hemiblock, or if you've got tricuspid atresia, or an inferior myocardial infarction. So you'll see a posterior hemiblock on the left gives you right axis deviation, an anterior hemiblock gives you left axis deviation. Now when we talk about the northwest axis, most of the things that cause a northwest axis can be seen as an extreme of things that cause left axis deviation. Emphysema, hyperkalemia, artificial cardiac pacing, and also ventricular tachycardia, depending on where the pacemaker is sitting in the ventricles. But there's also another cause of northwest axis, which you need to exclude before you start diagnosing the patient with pathology, and that's lead placement. If you've placed your leads wrong, you could be getting a false axis because the lead placement is all over the place, and you could accidentally diagnose someone with a northwest axis on an ECG when they actually have a normal ECG. So if you see a northwest axis, first thing to do, check your leads. Make sure you put the leads on properly. Now, let's talk about how to actually calculate the axis. And we're going to go back to this diagram over here of the 3 pairs of leads. Now, there are 3 steps in calculating a QRS axis. First step is you need to find the most isoelectric lead. Now what that means is it's the lead with positive and negative parts of the QRS complex that are most symmetrical. So it's either a lead with a very low amplitude on both, or the lead where the positive and negative amplitudes of the QRS complex are most symmetrical. Okay, so let's look at which one is the most isoelectric lead. Let's say it's AVL for argument's sake. Then the lead that is paired with AVL is going to be standard lead 2. So now you've found your most isoelectric lead, that's step 1. Now you've found the lead which is paired to it, that's step 2. And the third step is figure out whether the QRS complex in lead 2 then is positive or is it negative. If it's positive, you take the positive value of lead 2. If it's negative, you take the negative value of lead 2. So if lead 2 is positive, then your axis is plus 60 degrees. That fits between 0 and 90, so your axis is normal. Now what happens if lead 2 is negative? How do you calculate a negative? And the way you do it is actually pretty easy. So if a positive lead, like lead 2, was 60 degrees, positive 60 degrees, then to find the negative, you say that positive number minus 180. So 60 minus 180 is negative 120. So a negative lead 2 would have an axis of negative 120. The same way for any of the others. And if you have a lead that is negative normally, so let's say negative 30, then you'd say if that's when it's positive, that is negative 30, that's the value. Then for the negative, you'd say negative 30 plus 180. So the positive value of that would be plus 150. Making sense? And that's how you calculate the QRS axis. So let's go through the steps again. Step 1. Find the most isoelectric lead. And how do we find the isoelectric lead? We look for the lead whose positive and negative parts of the QRS complex are most symmetrical. Then we look at our diagram and we say, okay, which lead is paired with that? Now we look at the paired lead and say, is the QRS complex positive or is it negative? So once we know whether that lead is positive or negative, we take it to this diagram right here, which shows all the values of the QRS axis in each lead. And from there you just say positive or negative, apply your calculation, and you've got your QRS axis. Well, if you liked the video, make sure you subscribe for more content like this and more medical student survival tips. Leave a comment down below telling me, what do you struggle with most on an ECG? What's the step you struggle with the most? And if you want live video tutorials with me, make sure you send me an email on thehelpermedic@gmail.com or check out the Patreon in the link down below. Thanks everyone, see you next time.